I'm Dr. John Scharffenberg, a medical physician from Loma University, Loma, California. Today, I wish to discuss osteoporosis, a common problem of many people. What can we do to lower the risk? You see, if you have a hip fracture, 20% of those people die rather quickly. But of the survivors, 50% have a decrease in function. Of the people who have these hip fractures, within 1 year, 1/3 of them are in a nursing home under care. Exercise is the best preventive for osteoporosis. Osteoporosis means your bones are not strong enough. You're more apt to have these breaks. If you fall to one side or the other, you're apt to have a hip fracture. But if you fall backwards, you're more apt to break your vertebrae in the back. Now, you need to get adequate protein in your diet to prevent these kind of things. But most everybody who eats enough food to maintain ideal body weight has no problem at all of getting enough protein. You have to be sure you get enough calcium. Now, where do we get calcium from? We get it from milk. But if you don't use milk, you better get a soy milk or some alternative where they have added calcium to it. There's 37% more fractures in total vegetarians, in the vegans, than the lacto-ovo vegetarians. But it's only increased risk of fractures if they're getting less than 525 milligrams of calcium a day. If they get 525 milligrams or more of calcium a day, they have no greater risk of bone fracture than the people who don't drink milk. But how can we get that much calcium without taking a pill? We don't recommend taking a pill. They've shown that women who took these calcium pills had a higher risk of heart attack. So we don't recommend pills. We recommend you get the calcium in the food you eat. Now, one good way to increase your calcium intake is to eat salt. If you cut your cut your intake of salt down. If you cut your salt intake in half, it's like taking a calcium pill with 900 milligrams of calcium in it. You see, the sodium helps you to excrete calcium. So salt helps you to excrete calcium. You cut that salt intake down, and you get much more calcium. Vitamin D is very important. If you have inadequate vitamin D from the sunshine, your blood levels are low, and that's the only way to tell if you have adequate vitamin D or not, is have a blood test. If your blood vitamin D is low, you will absorb perhaps only 10% of your calcium that you consume. If you have adequate vitamin D, you will absorb 30 to 40% of the calcium you take. You should also know that osteoporosis correlates very well with heart disease risk. The people who have osteoporosis are much more apt to have heart disease. Of course, you should know that you shouldn't use tobacco and alcohol. That will always increase the risk of osteoporosis. So we can prevent lots of osteoporosis by exercise, getting adequate vitamin D, adequate calcium, avoiding tobacco and alcohol.